But the other vaccine we're going to be talking about today, too, is of concern to a certain group of people, and that is the pneumonia vaccine. We've been talking a lot about our lungs with COVID-19 and how that virus can affect the lungs. A lot of people have issues with breathing anyway, and so pneumonia would be the last thing they'd want to contract. Dr. Jerrica Mueller joins us now to talk more about that. Thank you so much, Dr. Mueller, for joining us.
Hi, thank you so much for having me. It's nice to meet you virtually.
Okay, so we are nice to meet you too. So we're switching gears from the ever popular flu vaccine and talking about the pneumonia vaccine, which I'm guessing has not been around as long. Is that correct?
It has been around for a while. And we have been vaccinating people for several years now. It just doesn't get as much publicity as the flu vaccine, and now, with COVID, the talk of COVID vaccine. But it has been around, and actually, we have been vaccinating children so well that we've actually recently got the guidelines have changed about the pneumonia vaccine in adults.
Let's just talk about, we've all heard of pneumonia, but what is it really? What is it exactly?
Yeah, so I think it's really helpful to talk about the anatomy and physiology first. So pneumonia is an infection of the lungs, and the lungs are very closely tied in with our cardiovascular system, our hearts. And so our lungs are responsible for when the heart brings back blood from the rest of the body. At the very molecular level, the lungs are responsible for oxygenation. And so I really like to use the analogy of an upside down tree. So the lungs are an upside down tree. So you have a large trunk that brings in air, and then the airways get smaller and smaller down to the very small level. And we call those like air sacs. And so what happens in pneumonia is some sort of organism is attacking the lungs and causes fluid accumulation in those little alveolar sacs and doesn't allow adequate oxygenation. So there's a picture here on the screen, and it's so when we're looking at films, we have to remember what we're looking at on the left is actually the patient's right. So, and vice versa. And so what we're looking at here is actually a right upper lobe pneumonia. And there are lots of different pathogens that can cause this, but a lobar pneumonia, which just means one of the lobes of the lung is affected, is really typical in what we call a typical pneumonia.
So, okay, so I can see that it's not symmetrical. That was the only thing that I could really tell about it, but I couldn't tell which one was wrong. So the right lung in this case is affected. How did do you have to diagnose it with an X-ray? Can you hear it with a stethoscope?
That's a very good question. So you don't need an X-ray to diagnose pneumonia. It just kind of supports our theory of, that it could be a pneumonia, but really patients, it's more of a symptomatic diagnosis. So patients come in usually with fevers, very short of breath. They can have a very fast heart rate. They can be breathing very fast. And oftentimes they'll have a cough with or without mucus production. And they can have some what we call pleuritic chest pain, but that just means some pain when they're taking in a big, deep breath. So we diagnose clinically. The patient tells us their symptoms, and then we say, oh, this is probably a pneumonia. And then we treat pneumonia as outpatient all of the time when patients are stable. Only usually when patients are very severe, they would go to the hospital, and we would do a chest x-ray and then confirm that there was a pneumonia.
So what signals severity? Is it the oxygen in the blood when you just take, is it an oxygenator or something you put on your finger to see how much oxygen is in the blood?
That's one of the ways that we measure. So when someone comes into the clinic or they come into the hospital, we definitely put on a we call it a pulse ox, but it just goes right on your finger and it tells us how well your lungs are oxygenating all of the tissues in your body. And then we look at other things like how fast the patient is breathing, how fast their heart rate is going, and those are alarm symptoms to us that maybe this patient needs to be admitted to the hospital.
And what's the treatment? Antibiotics?
So that's a very good question. It really depends on the underlying etiology. So pneumonias can be caused by bacteria. They can be caused by viruses as well as fungal. And so most cases are viral, but we do see many bacterial cases as well. And the type of infection in the organism really depends on the patient's age, their comorbidities, as well as geographic location. So the treatment for a bacterial pneumonia would absolutely be antibiotics. But, if someone has, say, a really severe flu, they can take something called, or it's a virus fighting medication, Tamiflu, that can help with those symptoms as well. But a lot of times, with viruses, it would be more supportive treatment, as antibiotics only address bacterial causes. And then there's also, if it were a fungal infection, then we could treat it with an antifungal.
You talked about age and comorbidities. What are the ages at which you get more concerned if someone gets pneumonia, and also what are the comorbidities, which are other illnesses or diseases that can exacerbate the problem?
Mm-hmm. So we really worry about anyone with an immunocompromised in an immunocompromised state, and basically that's saying that someone doesn't have as a robust system. So we worry about children, young children under the age of 5. And then we are concerned about our population that is over 65. These populations just they can't mount the type of immune response that adults, say from 18 to 64 with normal immune systems can. And so these are the populations we're concerned about. As far as the comorbidities, people who are at more risk are people with diabetes, particularly uncontrolled diabetes, as well as the underlying lung conditions. So people who have COPD, asthma, or even people who are chronic and current smokers. All of these conditions produce a lot of inflammation in the airways, and when they have a respiratory assault, such as pneumonia or just a viral infection, they're just not able to fight it off as well.
Okay, which brings us to the topic, which is the vaccine. Who should be getting it?
Yes. So I should first say that the vaccine is aimed for the most common cause of community-acquired pneumonia that's of bacterial origin, so Streptococcus pneumoniae. And so we have 2 types of vaccines. And as I mentioned earlier, we've actually done such a good job at vaccinating our children that we changed our guidelines. So what we give children is the first vaccine that you see on your screen, the pneumococcal conjugate vaccine PCV13, also known as Prevnar. So this is actually a vaccine that should be discussed with the patient's healthcare provider because we don't see as much pneumonia from the bacteria that are used in that pneumonia vaccine. What we do recommend is the Pneumovax, which is the PPSV23, and this is for anyone. We recommend for everyone who is age 65 and over, no matter what their previous vaccination record is, and then also people that are between the ages of 18 and 65 who have these chronic comorbidities that I mentioned, the COPD, asthma, that are smokers, diabetes, as well as people who have congestive heart failure and other chronic illnesses.
So let's say you're over that 65 and older group and you should be getting it. How often should you get it, and how effective is it?
So anyone who is 65 and over should be vaccinated, and it's just a one-time vaccine. The only time that someone would get it more than once is if they were younger than 65 and had some of these chronic conditions and got vaccinated at that time. But once someone is 65 and older and they get vaccinated, it's just the one time. And then they have very good protection against the 23 strains that are in that vaccine. Of course, there are more strains that it wouldn't be protective against, but when they were creating this vaccine, they brought together the most common bugs that they were seeing in pneumonia, and so that's what it offers protection against.
If you are older and have a heart issue, let's say, for example, can you still get the vaccine?
Absolutely. So we recommend it for anyone who's 65. It doesn't matter if they're, marathon runners or, if their health is not in prime condition. Anyone who's 65 and older should be getting it. And then just specifically if they're younger than 65 and have a condition that it doesn't allow them to have such a robust immune system, like heart failure, like diabetes, those are the people that should be getting it before 65. But over 65, everyone.
How about side effects?
Okay, so that's a good question. So, a lot of people are worried about side effects. So the most common is when they give it in the arm, in the deltoid. People can have some tenderness, they can have some redness and swelling in that area, but that usually only lasts a couple of days. Because the vaccine is similar in structure. So how it's created is they put together polysaccharides, which is just a fancy word for sugars, but they put sugars together that are very similar to the sugar coating on the outside of a bacteria. And so when they give the pneumonia vaccine, your body is able to create kind of memory cells about what that sugar, on that bacteria would look like. And so a lot of times people mount an immune response. They can get, a low-grade fever. They can feel tired, but usually these symptoms only last 1 to 2 days. And people are, I've often heard my patients say, oh, I'm allergic to vaccines. And, these side effects or these symptoms after the vaccination are very common. Almost everyone feels them. And in fact, only 1 in every million people actually has a true allergy to a vaccination. So these are the people that we would not recommend to get the vaccine, is anyone who's had a very severe reaction such as anaphylaxis to prior vaccination.
Okay, it doesn't seem as common as the flu vaccine to find. Where would we get them? And someone asked if insurance is covering it.
Yeah, so I think just as healthcare providers, we don't provide enough coverage and talk about the pneumonia vaccine enough with our patients. You really don't see it in the media like you do the flu vaccine and then now about the talks with COVID. But where you can anyone can talk to their primary care physician about receiving the pneumonia vaccine in clinic, as it's carried in most clinics. Patients can also go to their pharmacies and request the pneumonia vaccination. And Medicare, which is a very common health insurance for people who are over 65, covers the pneumonia vaccine 100%. And most commercial insurances also cover it.
And besides just sort of living a healthier lifestyle, are there any other specific ways to prevent pneumoninia from prevent yourself from getting it?
Yeah, so I think some of the other members of the panel were discussing about really good hand hygiene. And then right now in the era of COVID, it's so important to actively social distance. And if you're seeing anybody who is symptomatic, so they have this cough, fever, that's somebody that you would want to avoid because pneumonia is transmitted through respiratory particles. And so you would want to avoid those kinds of people, and you'd want to get your pneumonia vaccine. And for anyone who is smoking, not only do we as physicians care about the damage it does to your lungs, the increased risk for cancer, but it also predisposes you to getting pneumonia. So if you are currently smoking, please talk to your healthcare provider about taking the steps to quit.
All right, so it sounds like the words for today are wear your mask, wash your hands, and get your appropriate vaccines.
Yes, absolutely.
And Dr. Mueller, before we let you go, first of all, thank you for all you're doing in the healthcare world, particularly during this time. But you have a fan, Annabella Stark, made sure she wrote in while you were speaking to say you were fantastic. So just thought I'd pass the word.
Thank you. She's one of my colleagues, and thank you. We as residents are working very hard every day to take care of our patients. And when we graduated medical school, we had no idea what we were in for in the COVID times, and so we are having to think on our feet and learn every single day in something that is ever evolving. So shout out to all of my residents and my colleagues and everyone at GBMC and everywhere in the United States and really even the world who's battling, this COVID and trying to take care of patients through it.
Absolutely. We don't throw around the term heroes lightly, but we mean it when we say it about all of you guys who are working so hard during this time. Dr. Mueller, thank you so much for being with us today. Stay well. And thank you so much for joining us today and talking about flu vaccines, pneumonia vaccines, the potential for a COVID-19 vaccine. If you have any questions, the good people at GBMC will be able to answer them for you. And until next time, be well.